My name is Salman Farhat. I'm a Chief Cardiology Fellow at Mayo Clinic, Jacksonville. I'm very fortunate to have Dr. Abdullah Al-Sabagh as my mentor. We are presenting the use of endovascular snare to facilitate delivery of self-expanding valve during transcatheter aortic valve replacement. The authors have no relevant disclosures. Increased ascending aortic angulation or a horizontal aorta can introduce additional complexity to a TAVR procedure. A horizontal or unfolded aorta is particularly problematic for a valve-in-valve TAVR. The valve delivery system is naturally biased towards the outer wall of the aorta and can get stuck behind the surgical aortic valve frame. Attempts at crossing by pushing forward or rotation can result in vascular injury, including dissection. Our case is a 65-year-old female with history of surgical aortic valve replacement with a perimount 21mm bioprosthesis presenting with progressive dyspnea. Transthoracic echocardiogram showed a mean gradient of 50 consistent with stenosis. Mild aortic valve prosthetic regurgitation was also present. CT cardiac angiogram showed overall favorable anatomy for TAVR. However, extreme angulation of the ascending aorta was noted. The position of the surgical aortic bioprosthesis relative to the ascending aorta is shown. We measured an angle between the horizontal plane and the plane of the aortic valve greater than 60 degrees. After a heart team approach, we decided to proceed with transcatheter valve-in-valve using an Evolut Pro self-expanding valve. The conventional technique through the right femoral approach was initially attempted. However, given that the ascending aorta was horizontal, the Evolut Pro would get stuck behind the surgical valve frame and could not be advanced across the aortic bioprosthesis. Therefore, we decided to use an endovascular snare to flex and deflect the delivery system off the outer wall of the aorta. The Evolut Pro was removed and a 14 French sheath was placed in the right femoral artery. A second arterial access was obtained in the left femoral artery. A 35mm end snare was extruded in the ascending aorta just above the bioprosthetic valve through the left femoral access. An AL1 catheter and a straight wire were used to cross through the gooseneck snare and the aortic bioprosthesis into the left ventricle. The AL1 allowed a safari wire to be placed in the left ventricle. The AL1 was then removed, maintaining the gooseneck snare around the safari wire. Over the safari wire, the Evolut Pro was then re-advanced across the gooseneck snare and positioned in the ascending aorta. The gooseneck snare was then tensioned and pulled gently, successfully flexing the Evolut Pro. This video demonstrates the snare technique for flexing a self-expandable valve. Our technique allowed successful deployment and delivery of the transcatheter valve, an excellent final result. The patient did well post-procedurally and was discharged the next day. Recent study by Abramovitz et al. Shows that device success is lower in patients with high aortic angulation undergoing self-expandable valve implantation. These patients also have higher rates of post-dilation, more than mild paravalvular regurgitation, and pacemaker implantation. Balloon expandable valve delivery systems are intrinsically more flexible due to the short stent frame. Flexion can be controlled by the operator, also called active flexion. This leads to similar device outcomes in patients with normal versus high aortic angulation. In contrast, self-expandable valves have a longer stent frame, making them less flexible, and flexion cannot be controlled by the operator. This leads to decreased device success rate and increased risk of complications, including need for second valve, post-dilation, and more perivalvular regurgitation in patients with increased aortic angulation. Our case demonstrates the feasibility of using an endovascular snare to flex a self-expanding valve delivery system. The snare technique can help prevent complications such as dissection. Thank you so much for your attention.